All right, we're going to continue on with some special terminology for the abdominopelvic region of the body. The abdominopelvic region can be divided up into 9 regions, or over here on the next slide, 4 different quadrants. And now from what I understand clinically, the 4 quadrants are used more so than these 9 abdominopelvic regions, but we are going to cover both of them. All right, let's do the 9 regions first. Bring up my pen here. Let's start in the center, right here in the center of the abdominopelvic area. So right there, and then over here on the right-hand side, you can see internally what would be located in that region. So there's your umbilical region. The umbilical region is the area around the navel, and then of course all of the internal organs in the abdominopelvic cavity that are deep to the navel. All right, and then if you go either to the left or to the right of your umbilical region, you have the left and right lumbar regions, and we've already learned that lumbar refers to the lower back area. All right, now if you go inferior to the umbilical region, so down deep in the pelvis, like where the urinary bladder is located and portions of your small and large intestine, that is called the hypogastric region. Whenever you guys see hypo versus hyper, those are 2 prefixes you guys should learn right away. Hyper means elevated, like hyperthermia, elevated body temperature, hypertension, elevated blood pressure. Hypo is the opposite of hyper. Hypo means too low. Hypotension would mean your blood pressure is too low. So in this case, hypogastric means below the gastric area. Gastric refers to the stomach. So this is an area that is well below the stomach in the abdominopelvic cavity, so that's where it got its name. This can also be called the pubic region, as you see there on the slide or in your textbook if you're following along there. And then to the left and right of the hypogastric region, you have your iliac region on each side. That can also be called the inguinal region because portions of it are down deep in the pelvis. All right, and then if we go up above the umbilical region here, you have an area called the epigastric region. Here it is over here on this side. So epi is a prefix that usually means to lie on or over. So this region lies around over the stomach, since gastric refers to the stomach. So that's where epigastric got its name. A lot of people think their stomach is down here in the umbilical area, and it's not. Stomach goes up actually pretty high, very high, superior portion of the abdominopelvic cavity. All right, and then left and right over here, you have the left and the right hypochondriac region. That is not hypochondriac like somebody who complains all the time about imaginary ailments. We already said that hypo means below, beneath, lower. This word root here, cond, it is con, not chond, refers to cartilage. So this is literally referring to the region beneath cartilage. And so over here in your ribs, you have cartilages attached to the ribs here. And so that's what that's referring to. That's where those regions got their name, because those regions are along and below those rib cartilages in that area. Okay, so these are the 9 regions of the abdominopelvic cavity. And again, from what I understand, that terminology is not used quite as much as the 4 abdominopelvic quadrants. You can also divide the abdominopelvic cavity or region into 4 sections, and they're called the left upper quadrant and the right upper quadrant, or LUQ, RUQ, or you can call them the left lower quadrant, right lower quadrant, LLQ or RLQ. And the abbreviations are, from what I understand, used pretty frequently. It is a good idea for you guys to develop a sense for what major organs you would find in those quadrants. Because, for example, if you had a patient who was complaining of pain in the left upper quadrant, what what major organ do you see located in the left upper quadrant? Most of the stomach is located in there. Now, that's not the only thing you have in your left upper quadrant, but if a patient had pain up there, they're probably not having a problem with their bladder, which is down here divided in half between your right and your left lower quadrants. Or this little appendage over here, which is hanging off of the large intestine, that's actually the appendix. And so if you have appendicitis, you have extreme pain due to inflammation, infection of the appendix, then you're going to have pain in the right lower quadrant. So these terms are used a lot of times when describing things that are being reported by patients. All right, I'm going to pause this for a second. Okay, I'm bringing up visible body here. Three-dimensional anatomy software, which I have linked for you in the there on Blackboard in the anatomy area. So this is a 3D rotatable. You can see how I can rotate it here on the computer. Anatomy model, which is excellent, and you guys might want to check this out, or one of the free alternatives I have linked for you on Blackboard. But I brought this up because I want to just briefly so when we went over all those directional terms on an earlier video clip, you need to be able to apply those and be familiar enough with the anatomy, the things that you're required to learn here in Unit 1, to be able to apply those directional terms to relate different parts of the body to each other. And so we just learned a bunch of body region terms, for example. And so let's take a look. Let's go up here to the head. And so we said earlier, this poor guy has all of his skin dissected off. All right, so we said earlier, what did we say this area was? This was called the frontal region, and we said the chin down in here can be referred to as the mental region. So what directional term would you use to relate those two body parts? You could say the frontal region is superior to the mental region. Or you could say the mental region is inferior to the frontal region. And so that one's pretty obvious. Now let's consider, though, all right, what would you do if I asked you to relate the orbital regions around the eyes to the nasal region, the nose? Okay, so it's obvious that you could say, well, the nasal region is inferior to the orbital regions. But if we rotate our little model around over here, you could also say the nasal region here is anterior to your orbital regions. That's another term that you could use because the nose does project more forward on the body. You could also say the nasal region is ventral to the orbital regions. Can you think of another one? There's yet another one you could use. You could say the nasal region is medial to the orbital regions, or you could say your orbital regions are lateral to the nasal region. So since the body is three-dimensional, and you can divide the body using different planes of sectional planes, as we talked about earlier, many times you can use three different terms to relate to different body parts, since our bodies do exist in those three dimensions. All right, and then don't forget some of the other directional terms that you've learned, like distal and proximal, which are used. I stick to using those on the limbs, the arms and the legs. And don't forget about superficial and deep. And you have to be careful with that a little bit. Let me point out something to you here. For example, if you were thinking about the patellar region here around each knee, and I said, hey, you should compare the patellar regions to the sural regions. All right, the sural region is the calf. Okay, calf is back here. But your calves are really near the surface of the body, right? So you wouldn't say, you might be tempted to say, well, the sural region over here is deep to the patellar region. But superficial and deep refers to deep inside the body, not near the surface. Your calves are actually up here near the surface. So you wouldn't want to say that the sural regions or your calves are deep to the patellar regions or your kneecaps over here. But of course you could say that the sural regions are posterior or dorsal to the patellar regions. They're also inferior to the patellar regions. What's another one we could use? We could also say that they are distal to the patellar regions because they are further away from the trunk up here. So your sural regions are distal to the patellar regions, which are closer to the main trunk of the body. Okay, so you have to think about that whenever you're asked to use directional terms to relate to different body parts, because the body is a three-dimensional object. You can often come up with more than one term to use. Now, sometimes you kind of get into a gray area. Sometimes there's one that really jumps out and is the most obvious one that you would use if you were trying to describe to somebody how to relate to different body parts. And you might have one that's really obvious and then a couple of others that are more subtle. So in that case, if you're just choosing one, you probably want to use the one that's the most obvious, just for clarity. And so on your test, though, when you have your anatomy test, I am going to ask you to be able to use that terminology to relate different body parts to each other. And I'll provide some additional practice for you guys on Blackboard for you to do. And we'll probably might do some of that within the discussion forum as well, so you guys can discuss with each other your ideas about some of the answers. Okay, so I'm going to finish up this video clip here, and then you'll be able to move on to the next one.